These 2 years have been the toughest journey. I've struggled with a loss of self and disconnect in my career.
I will never forget hearing the distressed cries of COVID-positive patients as we sedated them to be ventilated, not knowing what their fate would be.
You never know if your placement was going ahead because of lockdowns or ward closures due to COVID exposure.
I started my graduate nursing program the day Melbourne went into its first lockdown. Due to COVID restrictions, I had limited or no opportunity to debrief.
It mentally stresses me not knowing when this will end.
It's been a marathon working and living in the COVID-19 pandemic for over 2 years. Nurses and midwives are exhausted, traumatised and burnt out. And while the community is enjoying a new normal, for nurses and midwives it still feels like crisis. Everyone has their story.
This roller coaster ride has had a significant impact on my mental health and well-being.
I was always worried that a big COVID wave would mean that I would graduate late and couldn't start my grad year.
My first year of nursing was pretty much filled with fear, anxiety, stress, and endless crying.
I feel mentally exhausted. The aged care facility I work in is constantly in lockdown due to a resident testing positive.
The pandemic has left many of us feeling burnt out and losing passion for our jobs.
Spending time on your well-being is an investment in yourself. Don't wait to hit crisis point. The Nursing and Midwifery Health Program is staffed by nurses and midwives like me. We offer a caring, confidential and compassionate service. Contact us before stress creates bigger problems in your life.
I would dissolve into tears, had a short fuse and felt on edge.
The stress of going to work every day, not knowing if you will have enough staff, plays hard on me.
What's getting me through the hard shifts is thinking that we'll return to normal practice to provide holistic care.
Sharing your story is an important part of healing and recovering. If you're anxious, depressed, not sleeping well, maybe drinking too much, we can discuss options and maybe put together a care plan. We're also a safe space to talk about family violence and can refer you to specialist services if required. No issue is too big or too small.
Self-care and knowing your limits are important.
I had to act and prioritise my mental health and well-being for my sake and my family's.
While midwives are resilient, I urge all of my colleagues to speak up about their feelings.
It's made me feel as if some people think nurses are robots who can handle anything.
We know you're doing an amazing job. You don't have to be a hero. We are only human.